is medication. So, not that I'm saying you should stop your medication, that would be foolish. Your medication is useful, it's helping you to manage your diabetes and manage your blood sugars, but there's two issues here. Number one, thinking that the medication is going to fix the problem and help you reverse or cure or fix your diabetic condition. That will never happen. You'll notice that in many cases when you're going to see your healthcare providers and when they're helping you with the medication, they're using the medication to help you manage your disease, not to help you fix the problem. That's going to be a common theme you'll see if you've just been diagnosed with diabetes, that the management of your condition is going to be the most commonly addressed. Not trying to figure out options of how to take care of the problem or fix or find a solution to the problem. On top of that, most of the medication being used for diabetes not only has secondary side effects that can be harmful, like GI issues, pancreatic problems, liver issues, and so on, but a lot of the medications can increase the risk of complications of diabetes. We know that things like secretagogues, like glipizide, glimepiride, glyburide, those types of medications, what they do, they tell your pancreas to produce excessive amounts of insulin. Now, what's interesting is that for type 2 diabetes, you are insulin resistant, right? So what sense does it make for your body to produce more insulin or to inject yourself with insulin? But the more insulin that you put into your body, number one, will cause you to gain weight, because we know that insulin is a fat-storing hormone. We also know that insulin at high levels will cause cardiovascular issues as well as kidney problems. And we see that through the research, that it's a 4 times increased risk for your heart attacks and strokes and kidney disease when you have high amounts of insulin. So if you're taking insulin through an injectable, or if you're taking one of those medications that is referred to as a secretagogue, which tells your pancreas to produce more insulin, these things are at risk for you. So in most cases, the medication itself could be causing you to become worse and more of a diabetic, because the more insulin you have inside your system circulating through your blood, the more insulin resistant you become. It starts to saturate or desensitize the receptors, or reducing the ability for your cells to accept insulin, and reducing the chances of your cells for accepting blood sugar, which causes the sugar to go back into the bloodstream, stay in the bloodstream, and it becomes elevated. And what happens is higher blood sugars are getting worse and worse and worse. So again, diet, exercise, losing weight, and medication, these are 4 of the things. What is the 5th one? Well, the 5th one is cause. The most important one. One of the main reasons why you still have diabetes is because you're focused on these 4 right here. These are the ones that you're focused on with your traditional healthcare. Now, there's nothing wrong with doing these things. It just does not get to the cause. See, the reason why you have diabetes is unique to you, right? There are multiple organs and systems and cells that are breaking down that is contributing to your diabetic condition. If your only focus on is to reducing blood sugars, you're never going to get to the underlying cause. Blood sugars themselves is a symptom of the disease and not the cause of the disease. But every single one of these things, these first top 4 here, focus on trying to lower blood sugar only and nothing else. So if your goal is to actually reverse your diabetes, maybe be able to get off some or all of your medications once your body is healthy enough, then you need to focus on number 5. That's the primary issue that hasn't been answered for you. What is causing your diabetes? What is the underlying problems that is going on? It is not your food. Your food can be a contributing factor, but it's not the cause. Because if it was the cause, when you change that diet, your diabetes should have gone away and everything should have been fixed. But the reality is the food will contribute to problems, cause things to break down, and whatever that is that's broken down will still be there. Exercise, yes, it's beneficial for the body, but it won't fix the problems that are still there. And same thing with losing weight. Remember, the weight is a byproduct of the condition, and it's not going to fix it. And obviously, the medication is only supporting and reducing the blood sugars. So you have 2 choices of what you're currently doing. The first choice is you can continue with what you're currently doing and hope and pray for a different result, right? Which will never happen, because the only goal in a medical model is to manage your disease process and not to fix the problem. All right, it's not because of not knowing what to do or uneducation. your healthcare practitioners, your doctors are very smart individuals. It's just the model is more about managing than really understanding what's really going on under the surface. The second thing you can do is you can find somebody who can help you find the cause. And that is specifically what we do in our office for our patients in regards to functional medicine. We're looking to see where the body has lost function, which is contributing to the diabetic condition. And once we focus on those mechanisms that are broken, that are not working properly, that person can live a better quality of life. Their symptoms start to go away, their diabetes starts to go away, the need for medication starts to go away, they feel better, and their quality of life is better for the rest of their life, for their family, for their grandchildren, for anyone else. We have a life to live. What does that life look like for you? Do you want to continue on the process of just hoping and praying that it's going to get better by continually doing these things, and eventually you get so frustrated you just say, forget it? Or do you want to take action to finally find out exactly what's going on and to have a customized plan of action to help you heal? That is a very key point there, because if you have diabetes right now, there is no one-size-fits-all approach. The approach has to be customized to your needs, because the reason why you have diabetes is going to be unique and different than why someone else has diabetes. Once we can hone in on that, it becomes very simple to address the problems and help you live a better quality of life. And here's the good news. There is no need for pharmaceuticals when you're actually doing this type of work. Now, I'm not saying you may not need your medications because you have excessively high blood sugars. What I mean that is we don't need to use pharmaceutical drugs to help your body heal. We can use more natural products to help you heal. I call it natural medicine. So if this sounds like something that you are interested in, maybe you need to start looking for a functional medicine practice like we have in our office. I'd be more than happy to sit down with you, have a consultation to evaluate your case to see if this type of care that we have in our office would be the right type of approach for your needs. We can always do it virtually or in person, whatever you feel more comfortable with. And you can always call our office to schedule an appointment one-on-one with me. I will put our contact information in the comments so you have that. If this video is something right up your alley, maybe it's time for you to have a consultation to see if you can get that help you need. Also, on top of that, I make sure if there's any comments, any questions, I would love for you to post some questions in the comments. I'd be more than happy to reach out and respond to those. If there's something specific that you're dealing with, that you're concerned with, and you want me to have a video or to explain more about what's going on with your specific situation, post in the comments. I'll see about trying to put a video for you as well. Lastly, please like this video, share this video. It's very important that we get this information out, because there's someone right now that is dealing with diabetes, suffering with this condition, looking for another option, and this video may be exactly what they need. So again, I hope that this information today was worth your time. Again, comments if it was worth your time. Like our page. We can go to our Facebook page, also our YouTube page, to hear more about these videos and see more of the type of things that we do in our office, video testimonials, anything that we can do to help you out, to get you back on your track for health. We'd love to help you out. All right. Have a great rest of your day. I look forward to seeing you next time. Take care. Bye-bye.